Okay. Well, Mr. Wilson, your checkup on this visit is excellent. Your exam looks good. There's nothing else we need to do. I think our next appointment would be 6 months from now. I think that's all you need, and I guess the question is that comfortable for you? And what else would you like to ask during the visit here today?
Well, I'm kind of concerned. It's been like coming up on 3 years since the operation, and I thought by now I would probably need like a stress test to make sure everything's in line, everything's working right.
That's a very legitimate concern. Many patients express that same concern after they've had bypass surgery. We have good data now indicating that we don't need the stress test to predict your outcome after the bypass surgery. So we don't have to do a stress test. I mean, we have your cholesterol, we know your blood pressure is normal. All the things that we look at that would put you at risk are really in excellent shape. The fact that you're out swimming every day really means you're exercising well. And so our guidelines are, if things change for you, let's say you're swimming and you notice your breathing isn't right, or you start to notice some kind of tightness in the chest, those are the things that would indicate that we need more testing. It could be a stress, it could be a cath, but right now, in the absence of any symptoms and your excellent laboratory studies, your excellent status with exercise, we don't need to do another stress test. So I think I can reassure you that you don't need it now. At 5 years, we can discuss it, because that's what our guidelines say, that we can use a 5-year window rather than a 3-year window for a stress test.
Oh, okay. Yeah, if you say 5 years, and I thought they were done sooner. That's all. But that's reassuring that if everything else is going well.
Right, and I'll repeat and emphasize the fact that anything that changes, we need to hear from you.
Yeah,
you need to call us, and we'll respond to that very quickly. But in the absence of anything changing in your exercise capacity or your general health, I think we don't need anything else done right now. Twice a year we'll visit. Once a year we'll do your lab work. Your exercise is an excellent thing to keep going with, and as I said, the phone numbers are always there. If there's any issues or concerns, you call us back and we'll respond to that.
Okay, I appreciate that.